Hi everybody, my name is Luke. I'm a physical therapist at Full Potential Physical Therapy, and I just want to talk a little bit today about the anatomy of the shoulder. So I want to start with a video here that talks some about the bony anatomy of the shoulder and hopefully gives you a little bit more education on some of the complexity of the shoulder. So when we often think of shoulder, almost everyone will point to right here, and that absolutely is part of the shoulder. But the shoulder, unlike maybe joints like a knuckle joint at our finger, which is really just one joint, is a whole complex of joints. And there are four main joints that make up that complex. So one is the tip of the shoulder, and maybe an easy way to do this is to follow along with me at home and just kind of touch on some of these areas, and you'll feel how movement at one area means movement at other areas too. So the tip of the shoulder joint is what's called the glenohumeral joint. It's what we think of as the shoulder, the ball in the socket. So that's one joint. When you hear of things like rotator cuff issues, labral issues, these are all referring oftentimes mainly to that tip of shoulder joint, the glenohumeral joint. If you then take your fingers and you follow along your collarbone, we come to another joint here, and it's called your sternoclavicular joint, and it's where your collarbone runs into your breastbone. So if you move your arm, and if you get it up to a certain height, what you'll realize is that there's motion happening at that joint also. So it's called your sternoclavicular joint. Then if you run back up your collarbone until you feel kind of a bump on the top of your shoulder here, that is called your acromioclavicular joint, and it's where your collarbone meets with your shoulder blade. So once again, if you raise the arm or you reach out in front, or even if you turn your arm out to the side, you'll feel some motion at that joint too. Lastly, so this is the fourth joint of the shoulder, you have where your shoulder blade meets your chest wall, and this is called your scapulothoracic joint. This joint also plays a big role in reaching, pushing, pulling. When we move the shoulder, the vast majority of the times, all four of those joints are involved in some way or another, to some proportion or another. So the shoulder joint, much more than just the tip of shoulder, includes the whole portion of our body here and all four of those joints. Thanks.